Degenerative disc disease is a difficult condition to live with. However, it does not need to hinder the rest of your life. Here are 3 things you can do to control your disc degeneration. Stay active to slow the disc degeneration, reduce lower back stress, and improve nutrition. Controlling pain is crucial, but even if it doesn't disappear entirely, the most important step for patients is to stay physically active. Exercises not only preserve what functionality exists, they are the single best way of healing the vertebral spine. Exercise increases the flow of blood and oxygen and other nutrients to the vertebrae and discs, thereby keeping them hydrated and as pliable as possible. Exercise can also improve one's sense of well-being by promoting the release of endorphins, a natural pain reliever and stress reducer. Staying active does not require a lot of innovation, but it does require planning, such as strengthening with aerobic conditioning and stretching. Alternating 30 minutes of strengthening exercises with low-impact exercise like walking, biking, or swimming every other day can maintain flexibility and mobility, as well as control weight. For those who are in too much pain to tolerate much exercise, a gentle approach is best. Water therapy is particularly gentle on the lower back, as the water provides support for the weight of the body. Doing 5 minutes of stretches first thing in the morning and the last thing before bed will also significantly increase mobility. Hamstring stretching is almost always important for patients with lower back pain. Additional, more targeted stretching, such as piriformis stretches, may be advisable, depending on the patient's diagnosis. Investing in a few hour-long sessions with a physical therapist or certified athletic trainer knowledgeable about low back pain can provide adequate guidance and ideas for back exercises that can be done with and without exercise equipment. The corollary to undertaking productive activity is stopping destructive activity, and there are many opportunities throughout the day to modify common actions that can hurt a degenerated disc, such as correcting posture and using low back support, changing position often to relieve stress and increase blood flow, lifting heavy objects correctly, and comfortable sleeping. Degenerated discs are frequently more painful when an individual is sitting, especially if he or she is slumped forward, putting more pressure on the lower back. Sitting upright in an ergonomic chair that provides low back support for the natural curve in the lumbar region can prevent irritating intervertebral discs. Hanging a small mirror near their desk can allow patients to check posture and remind them to straighten up. Just standing and walking 10 paces every 20 or 30 minutes is enough to prevent low back stiffness from setting in. Lifting heavy objects correctly involves holding the object close to the body, engaging the large quadriceps muscles in the thighs, and placing the object by pivoting the feet, not twisting the back or torso. Leaning over from the waist should be avoided. Finally, sleeping on a comfortable, supportive mattress can make the difference between waking up refreshed and waking up stiff and sore. There are many mattresses designed to provide support to the natural curves of the back, and patients should choose the type of mattress they feel most comfortable in to help them sleep soundly at night. The health of one's spine reflects the overall health of the body, and a healthy diet plays a role in moderating the low back pain of degenerative disc disease. Specifically, intervertebral discs benefit from hydration and oxygenation. Patients can achieve both hydration and oxygenation with small changes. Hydration can be improved by sipping water throughout the day, especially during and after exercise, as well as eliminating or reducing use of caffeinated drinks such as coffee, some teas, and soda. Alcohol use should be minimized. Alcohol not only decreases hydration, it is a depressant. Using alcohol to self-medicate and numb pain can start a cycle of unhealthy actions, interfering with everything from sleep quality, the ability to make healthy food choices, and the motivation to exercise. Smoking or any nicotine intake should be eliminated because it interferes with nutrition for the spinal discs by preventing the good oxygen flow needed to keep them healthy. Although the term degenerative disc disease sounds fearsome, for most people the low back pain and other symptoms from lumbar degenerative disc disease can be managed quite effectively with self-care. By making a concerted effort at managing the pain, most patients will find that they can keep the pain to a tolerable level and continue to enjoy their favorite activities without having to undergo major surgery.